The cries of distressed children ring through this ward for the severely malnourished in the Somali capital, Mogadishu. A growing number of parents are unable to feed their children, many of whom are dying.
My son was first diagnosed with malnutrition at Banadir Hospital, where we took him for a stabilization program. He stayed there for 20 days, eating therapeutic food. He was ultimately released from the stabilization ward, but within days he relapsed and his situation became critical, ultimately resulting in his unfortunate death today.
My daughter has had severe acute malnutrition for almost 9 months now, and the only center she could rely on has closed. We don't know what to do now, and I appeal for our aid to be restored and for UNICEF to provide us with food.
Food insecurity is, of course, not a new problem in Somalia. For decades, much of the population has faced hunger and malnutrition due to factors related to climate change, drought, and most of all, conflict. Some of these problems were overcome, at least temporarily, through international aid, much of which came from the US government. However, the Trump administration's decision to halt such funding to carry out a review has cut this lifeline. Doctors and aid agencies say it's had very worrying consequences.
This month and last month, more than 500 malnourished children were treated at the center. This situation results from funding cuts leading to the closure of many child nutrition centers and the layoffs of health workers, which has had catastrophic consequences.
Nutrition situation in Somalia is very critical, with approximately 15% of children suffering acute malnutrition, among them nearly 500,000 with the most severe form of acute malnutrition at a very high risk of death. Upon the funding cuts, UNICEF partners immediately stopped services that provide life-saving support, which includes therapeutic supplies, supplemental and medical drugs across the country.
Aid agencies are calling for the lifting of the funding cuts suspension in order to save the situation and avert a calamity. Joy Kiruki Juma, CGTN.